At 11 stories, 1 million square feet, and nearly $500 million, the Sanford Fargo Medical Center sets records. It's the largest private construction project ever in North Dakota or for Sanford Health.
Planning for this and planning for the move pretty much pulled in every employee we've got.
Planning started back in 1999 when the health system bought nearly 140 acres at the intersection of two interstates, before anything surrounding the property had been developed. Sanford committed to the project in 2009 when it merged with Merit Care.
That launched a lot of planning, and 7 years later, we're here today.
Paul Richard leads this region for Sanford. He's retiring in August, and the project has brought his career full circle. He started here as a clerk in medical records in 1971.
You know, there's always additions going on, but I think to start a freestanding hospital, medical center of this complexity would be rare.
But the growth of Fargo, the limitations of Sanford's downtown campus, and the goals of the organization demanded it.
There's very few reasons why people should have to leave Fargo Moorhead for healthcare. When you want to accomplish that as a goal, you have to have the house in which to accomplish that, and that is this house.
This hospital was built during the height of the North Dakota oil boom, so labor was tight, construction costs were going up, and one of the ways Sanford dealt with it was by manufacturing entire components of this facility off-site. So every bathroom, for instance, was built in Ohio and then shipped here. It resulted in one of the lowest cost per square foot of any major hospital project in the country.
Around the patient experience, we all know that light, color, sound is all very important, and sound from the standpoint of quiet. And so we really focused on how can we deliver a different patient experience here from what we have traditionally done.
Every patient room has a window with a view, and many have spaces for families to stay together. The design allows natural light throughout the building, and the focus on local art led to 1,700 spots for artwork.
It's all important. It's about the overall experience and getting away from that sterile, I'll call it clinical, look that I think hospitals typically have been.
There also are 3 restaurants serving not just visitors, but the more than 1,500 people who will work at the hospital. And while the first patient will be seen in late July, Sanford has more land left and more plans to expand its services in the area.
It's the end of a big project, but it's also the beginning of a lot of other things that we're going to be doing in the Fargo market.
For more Sioux Falls business news, visit us at www.siouxfalls.business.